All. This is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. So I presented a study last week about the postural tachycardia syndrome, postural orthostatic tachycardia syndrome, or POTS, and a new study that shows that POTS incidence is increased after vaccination and increased 5 times more after COVID infection. In my last discussion, I deliberately left out the 5 times more in infection, deliberately because I was not sure how did they calculate the numbers. So I wanted to share with you my concern with this study. So on one end, I understand that vaccinated individuals who are vaccine injured have this study as a proof to say, look, it can cause POTS and other injuries too. Similarly, there is also this messaging too, that if you're not vaccinated and you get infection, you have a chance of getting POTS, likelihood of having POTS 5 times more than if you were vaccinated. So these are the kind of narratives that are in the press right now. However, I am really concerned about some data points. I want to show you those. So let's start a discussion with me showing some of these references. So first of all, this is drbeen.com. And for your beautiful holidays, only for one time $67, you can get access to drbeen.com, where there are another 900 awesome lectures. With this, here is the definition of POTS, postural tachycardia syndrome, diagnosis and treatment, basics and new developments. Here they say, this is from the American College of Cardiology, and they say POTS is defined as the presence of chronic symptoms of orthostatic intolerance, meaning standing up, equal to or more than 6 months, accompanied by an increased heart rate more than or equal to 30 beats per minute within 10 minutes of assuming an upright posture, and in the absence of orthostatic hypotension, blood pressure fall greater than 20 by 10 millimeter of mercury. So I just want to leave this in here as a baseline for us to understand that POTS diagnosis usually requires 6 months of observation, although in this study they used within 90 days as the diagnostic criteria of duration. So that actually can create some concern that there will be some diagnosis that is missed, and there may be some misdiagnosis as well. Then going here, this is a beautiful article written by Svetlana Blitzstein. I actually left her a message today as well because I wanted to understand a little more about some of these numbers over here. So we'll wait for her response. She was one of the peer reviewers as well. She has a clinic where they manage autonomic dysautonomias. I have no relationship or no commercial interest, no other interest as well. This is my first time I'm coming in contact with her because of this study. So thank you for writing this article. Then here is the study itself. Published 12 December 2022, apparent risk of postural orthostatic tachycardia syndrome diagnosis after COVID-19 vaccination and SARS-CoV-2 infection. Then I want to show you some more data here. This is the table 1 for vaccination. The number of vaccinated in this study were 284,592. Look at the difference in the numbers with the infected. That was 12,460. So both are larger numbers, but not really comparable unless they are adjusted and matched. So this is a concern for me. Then these were the other common diagnoses that they used as an understanding of what was the baseline common diagnoses that were occurring. Then this is the Dr. Blitzstein, and she is one of the peer reviewers. This is her clinic and dysautonomia clinic, I believe in New York. Then here is the news cycle. So I have my ad blocker on because ads start running and that cause a lot of processing uh, take o- taken away, and I am sharing my screen and presenting, so I've blocked it. But here is I believe this is an NBC News. POTS, a debilitating heart condition, is linked to COVID and to a lesser degree vaccines. I'm going to close these. So then I really respect this journal or publication, News Medical Life Science, and I actually really like Pooja's work as well. Here she has mostly reported on the same study that we discussed before as well. These links will be in the description. Then here is UPI, and they're talking about risks of POTS heart condition linked to COVID-19, study says. So I want you to kind of take this message from all of these news cycles, that what they're saying is that the POTS is more prevalent, 5 times more prevalent with after COVID infection versus after vaccination. Vaccine increases in the vaccinated group, the incidence of POTS is also increased. So that is there. But after infection, it is 5 times. And that's what I want you to kind of hold in your mind till I reach a point to show you that data and the issue with the data. Then postural orthostatic tachycardia syndrome post-COVID vaccination, less likely versus infection. So once again, keep this in mind. Post-COVID vaccination, less likely versus infection. I think that data does not support this very well, and that is the confusion I want to put there. I'm happy to remove this video once I receive the clarifying data or explanation. So imagine this is a temporary video that I'm sharing my concern with you till we get more clarity, and I'm still digging in to figure this data out. COVID infection, vaccination linked to heart condition. Then WebMD, COVID infection, vaccination linked to rare heart conditions. A new study links COVID-19 with this debilitating disease. Yahoo News, POTS, a debilitating heart condition, is linked to COVID and to a lesser degree vaccinations. What you need to know about COVID-19 and POTS. mRNA vaccine and COVID linked to POTS, a debilitating condition affecting heart, other organs. And then some more. Then rapid heartbeat conditions 5 times more likely with COVID than with COVID vaccine. And then top news stories, this is EMA, and they also have this over here. Research confirms link between COVID-19 POTS and POTS mRNA vaccine. So interesting that so many good specialists, experts, scientists have looked it up and discussed it. Now it is, without rediscussing it, I'm going to go into some interesting data points that are kind of interesting for me. So give me 1 second. Let me bring my. So here, this is the study, Postural Orthostatic Tachycardia Syndrome, or POTS. So this study has 2 cohorts. One are vaccinated individuals. They are 284,592, and the researchers looked at the POTS incidence in them before vaccine and after vaccination. Then they also have another smaller cohort, relatively smaller, otherwise larger, 12,460 infected individuals, and they looked at the POTS incidence before and after the infection. Researchers assessed the association of POTS incidence change within each group. So they assessed that, hey, those who are vaccinated, what is the POTS incidence rate before and after the vaccine? And similarly, they did that for the other group as well. So that is all cool. And they actually found the difference. So that means after vaccine, there is an increase and uptick of POTS. And similarly, after vaccine, there is an infection, there is an uptick of POTS as well. But is it 5 times? That is a question. So before I go to that data point, conclusion from the article, I have just copy pasted that over here. In summary, researchers said, POTS-related diagnosis appears to be acquired with increased frequency after, compared to before, COVID-19 vaccination, particularly when compared to more commonly diagnosed conditions, but at a rate that is approximately 5 times lower than after SARS-CoV-2 infection. So there are two important things here. Number one, they're saying, yes, we have seen now in the data that POTS incidence increases after the vaccine. They're saying that we're not saying this is the cause of it, vaccine is a cause, but they're saying there is an association there. However, they're saying it is 5 times lesser than infection. So that means the conclusion is that, hey, infection is bad. So don't try to expose yourself for infection, go get your vaccine. And again, I would never recommend infection. However, I want to look at this data together with you. Here. This is the data that is coming from their table. So let's just very quickly look at those tables as well. So here is the table 1. This is the vaccinated folks and their data. And if you see here POTS, there are actually multiple groups for POTS here. Some of them are not statistically significant. Some of them are. So I'm just going to use this line that I believe the reviewers used as well. So this is the POTS after vaccination, and this is the table 2, that is POTS incidence before and after the infection. So now let's go back to the data. So here is what happened. Vaccinated 284,592 people. 501 developed POTS before the vaccine. So that was 0.18% incidence or rate of POTS. 0.18%. Please keep that in your mind. Then POTS incidence after the vaccination was 0.27%. So before 0.18%, after 0.27%, this is vaccination. So odds 1.52. And if you wanted to see the 95% confidence interval, you can look at those tables. I wanted to keep this data point as clean as possible. Infected 12,460, a smaller group, not really good to compare these two, but still. POTS before the infection, COVID infection, look at the number, 123 for this group, 0.99%. 0.99%. Now, in the vaccinated, the rate before vaccine was 0.18%. So before any exposure of vaccine or infection, the two cohorts have a huge gap in their incidences. One is 0.18%. That is almost 568 people getting vaccinated or 568 people to have one POTS case. This is before vaccinated. Versus in the infected group, there is 1% per 100. So very different rate or incidence. What is the difference between them? Now this is before infection, before vaccine. What is the difference between them? 5.5 times. The rate of the incidence of POTS in the cohort that will become infected in this table, of course we do not know who will or not, but at least in this data point, they had POTS 0.99 or 1 per 100 versus those who are going to get the vaccination 0.18 per 100. These are not even comparable. They are already 5 times different from each other. The incidence of POTS is already 5 times higher in the cohort that will be infected cohort. Now, after the infection and after the vaccination, after the exposure of the event, vaccination POTS incidence 0.27%. So it went up from 0.18 to 0.27. Look at the infected post-infection 2.08. And again, this is within 90 days. So the criteria isn't really that great. But anyways, let's go with that. 2.08. So it went from 0.99 to 2.08. The one above went from 0.18 to 0.27, almost kind of double. So one was 1.52 times and the other one was 2.11. So yes, for sure, infected individuals have a higher incidence, slightly higher. But now here is, I think this is where the confusion is, and I'm totally happy to remove this video if the authors come back and they say, hey, you got it wrong. To me, it seems like what they then did was they compared this vaccination group 0.27 and the infected group post-infection 2.08. They divided them. That came to be 7.7 times different. But then they adjusted for 2 dose, 1 dose, 3 dose, and then they came back and they said 5 times difference. But that 5 time difference was already present even before the exposure to the event had occurred. 0.18% versus almost 1%. That's almost 5 times difference, 5.5 times. So these cohorts were already 5.5 times different without any event. So are they technically correct? Yes. They're saying that, hey, the difference between them is 5 times. But did they explain or discuss or address that there was already a difference of 5.5 times or 5 times before? Isn't that interesting? So I am still digging to figure out why this anomaly is present. So it seems that the post-vaccine POTS rate is 1.52. So increases for sure. Post-infection POTS is 2.11. So post-infection is more. That was 1.5 times and this is 2.1 times. However, the data don't seem to be comparable. And then POTS diagnosis within 90 days. Now I want to show you something more as well. If I go back to the analyses here by Dr. Blitzstein, her numbers are actually higher than mine. Her numbers are, so her vaccine numbers are the same as mine, and that is 0.18% before the vaccine and 0.27 after the vaccine. That is the same number as I showed you here, 0.18 and 0.27. However, her second numbers, infection cohort number, before the infection, 1.73% was the incidence rate. After the infection, 3.42. So let me ask you this once again. There are 2 groups of people. In one group of people, the POTS incidence is at 0.18%. In the other group, before any vaccine or infection, the other group, POTS rate is 1.73%. Can they be compared? Here it is 10 time difference before the exposures, before the infection or before the event, vaccine event. Their difference with each other is already 10 times. So if I now go back to you and say, you know what? And it is also possible that some of them are actually infected and not known to be infected. And they may have a greater chance of getting POTS, maybe. But these are the kind of questions. So if I come to you and I say, I have 2 groups. They both have, before any intervention, infection or vaccine, they both have a 10 times difference in their incidence rate. Then I come back afterwards and say they still have the 10 times difference after the vaccine and the infection. But I only want to tell you that here after the vaccine and infection, the difference between them to each other is 10 times. Would that be very accurate to do? I think it is correct from a data point of view, but it may not be addressing that why were these cohorts already 5.5 times different and they stayed to 5 times difference, actually difference reduced afterwards. What was that situation. So that is something that I'm looking for. I'm digging in. I'm trying to figure out. I've sent an email to Dr. Kwan. What is his full name? Dr. Kwan, Alan Kwan. So I've sent him an email. I've reached out to Dr. Blestein as well. I have actually discussed this with a couple of good statistician friends as well. And this is the discussion. One of the friends said that this study doesn't, at least with the data that is disclosed and with the narrative that is offered, it does not really explain this baseline difference. So I am not comfortable using this study to say that there is a difference appears after the intervention that is 5 times different, because the difference before the intervention was also 5 times. So with this, thank you very much. Please like, subscribe, and share. There are links in the description if you would like to support this work. You can buy me a coffee, or you can use PayPal. You can become part of Substack. You can become part of YouTube channel as well. And happy holidays. I will see you again. Bye for now.